Welcome everyone to the Alberta Transplant Institute seminar series. I'm Lori West, and I'm going to introduce our topics and speakers today. And we'd like to, as I'm doing that, we'd like to gratefully acknowledge the support of Paladin, whose support has allowed us to put together this seminar series at the moment as we have relaunched in this autumn 2021 season. So today we have a really interesting program focusing on another donation issue. In 2019, as some of you know, Nova Scotia became the first jurisdiction in North America to pass deemed consent organ donation legislation. And in order to evaluate that, the Legislative Evaluation Assessment of Deceased Donation Reform, or the acronym LEADER, the LEADER program, was established, funded by Health Canada, to evaluate the implementation and the impact of these new legislative changes. And part of the LEADER program's objective was to analyze public perceptions and responses, which we're going to focus on today. We have two speakers today. Alessandro Marcon has been a research associate at the University of Alberta Health Law Institute since 2015 and has very recently, sadly for us, relocated to Ottawa. Focusing primarily on the dissemination of health information, he has led and contributed to research projects that explore how the media, especially the popular press, Twitter, YouTube, and so on, represents key health and science policy issues. And he's worked closely with Tim Caulfield on some of these projects. Some of these projects include solicitation of living donors, immune boosting practices, and misinformation about the supposed cures to the current COVID pandemic. Sandro holds an MA in Applied Linguistics and Discourse Studies with a specialization in digital humanities from Carleton University. Before we hear from Sandro on the LEADER project, which I should just add is also been highly worked on by David Hartel, who many of you will know from his work with the CDTRP. So first, however, we're going to hear from Cindy Krieger. Cindy is the Albertan mother of Morgan, who sadly passed away while at university in Nova Scotia in 2018. Morgan became an organ donor, and her gift of life saved several lives, including heart transplant recipient Monique Pelletier. Cindy and Monique found each other through social media in 2020, and we're going to hear first from Cindy and then Sandro, followed by a joint question and answer session, and then open discussion and finally announcements. So with Patricia's help, we're going to turn things over now to Cindy.
Hi, I am going to talk about our daughter Morgan Krieger, who was an organ donor. In 2017, Morgan moved out to Nova Scotia to attend university there. Morgan was a classical singer and loved to sing, and she decided she wanted to take musical therapy. At that time, there were only 3 places across Canada offering musical therapy. And of course, Morgan chose to fly the furthest away from home to attend university. So Morgan was very happy there. She was very happy to pursue what her passion was. Morgan loved to sing. She loved to help others. And that's our girl. It was 1 week after Morgan was back from Christmas holiday. She was back in Nova Scotia. We received a phone call the Sunday evening, and they told us they had Morgan in the hospital. They'd found her in her dorm room, and she was having many seizures. and they weren't sure why. Morgan was type 1 diabetic, so right away I mentioned that to them, but they already knew that. They weren't sure if the seizures were from her being too low or too high. So after talking with the doctor, he called me back half an hour later, and I said, should we fly out and come spend some time with Morgan? Is this quite serious? And he said, actually, I think it would be a good idea. If you came out, she's going to pull through, but it would be a good idea because this is going to be a very long journey. So we hopped on an airplane an hour later, and we arrived at the hospital Monday morning, and they came in and they told us that she still had quite a few seizures throughout the night, so they put her into induced a coma. And they were going to take her out of a coma, and it would take a little while. And they just said, just be prepared. She might not know who you are at first, and it's not going to be your regular daughter, but she's going to come back. And they said, we're going to do a CT scan on her in a day or two, and we're going to do an MRI in a couple of days. She's not stable enough right now to take her off to do an MRI. And then about half an hour after that, they came in and they told us they were taking her for an MRI. So we knew right then that something wasn't going quite right. They came back and they told us that Morgan wasn't going to pull through, that because of the seizure she'd had too much damage, and she was going to pass away from brain death. So at that time, they asked us, did we know whether or not Morgan wanted to be an organ donor? And we said, yeah, we did, because funny enough, we'd had a family discussion around our table 2 months before she left, and we have a son too, Braden, and my husband, myself, and our son and Braden and Morgan, we talked in quite length about organ donorship. So after that, somebody else came into the room and they talked to us about organ donorship. I believe it was Legacy of Life that came in. And they said, we have to transfer her to Halifax if she wants to be an organ donor. Is that okay? And we thought that was perfect, because it wouldn't hurt to get a second opinion from other doctors too, to make sure that this is really what was happening. So we went off to Nova Scotia, to the Halifax hospital. And when we got there, we then had 12 other family members fly in, her brother and grandparents and aunts and uncles and everybody, to be there with us. And we sat there and we watched Morgan. She looked like she was just sleeping peacefully, but she never opened up her eyes at all. And then we talked with Legacy of Life, and we went through everything, and we signed the papers for Morgan to be an organ donor. 72 hours later, they came to us and they said to us, we're sorry, but if Morgan doesn't pass away right away here, she's not going to qualify to be a donor. And even if she doesn't pass away, she's never going to be your Morgan again. And so we were like, obviously upset. So we all went into the room and we held Morgan's hand. And we said to her, Morgan, we love you, sweetheart. We will do anything we can if you do not want to pass over. If you want to fight to stay with us, we will do everything we can. It was at that moment that Morgan took her head and shook it no, and we'd had no response from Morgan from the day we got there. And we also said to her, sweetheart, we love you. And if you choose to be an organ donor, the choice is yours. There will be no judgment whatsoever. We love you no matter what. Half an hour later, Morgan stopped breathing. So this sits heavy, because I really do believe Morgan chose to be an organ and tissue donor. I also believe Morgan handpicked all her recipients. It was not an easy process to go through. We had to stay in Nova Scotia 2 or 3 extra days because before they could cremate Morgan, and they had to start with the heart transplant and then go through everything. Morgan also donated all her skin and tissue, which makes us very excited too, because her skin and tissue, they can keep for up to 5 years, and with the cells of it grow more to share even with more people. So when we got the phone call about Morgan's skin and tissue, they told us that it was pristine, and we we were not surprised. We do know this was Morgan's wish. Being part of a family that's an organ donor has helped us, knowing that Morgan has gifted life to others. It's terrible losing a daughter at 19 years old. It's the worst thing that could ever happen. And but it warms our hearts to know that Morgan is still out there, and she is sharing her gift with others. That's who Morgan was. She always liked to share and was passionate about helping others. Bringing opt-out into Alberta, I think, is a wonderful gift. When opt-out actually came through in Nova Scotia and was finalized, it was last year, January 18th, 3 years to the day that Morgan passed away in Nova Scotia. So I really am passionate about bringing it to Alberta, because I really do feel that all the stars are aligned. And I do feel Morgan sitting there with us saying, okay, come on, like I'm doing what I can from up here. And is there anything you can do, Mom and Dad, to help out? Thank you.
Well, thank you so much, Cindy, for sharing this powerful story of your beautiful, amazing daughter, and what you went through as a family to ensure that her wishes were met, and have clearly brought you some degree of comfort as the months go by, months and years go by. It's impossible not to be profoundly moved by this story. And we deeply appreciate you sharing it with us. We will have some time, if anyone has any comments or questions for Cindy a little bit later. We've got the idea of deemed consent is something that often comes up when we consider issues related to organ donation and how to make it smoother, better, easier, to meet the opportunities, to offer the opportunities to individuals who become organ donors, and for whom that's a hugely important event. Sandro is now going to talk to us about the recent Nova Scotia legislation and what that means potentially, as that's evaluated, what that could mean for other provinces. Sandro, we'll turn it over to you now.
Thanks a lot, Lori, and thank you to Cindy for sharing your story. That was very touching. So yeah, I'm here to talk about the deemed consent legislation changes in Nova Scotia and some particular work that I've done on the public response that's met those changes going on in Nova Scotia. So what is deemed consent in the context of organ donation? Just in case no one knows, there's other names for it, but it basically means the same thing. It's sometimes called presumed consent or opt-out as opposed to opting in. Eligible people will be seen as having consented by donating their organs and tissues after death unless they opt out. So basically everyone is eligible, everyone who is eligible is a potential donor unless they state otherwise. And there's many countries that have implemented deemed consent legislation, and many countries and jurisdictions have been considering the change. So there's kind of a movement going on with new countries doing it. This includes provinces in Canada in the past. Other provinces have considered it and will be considering it again. When I talk about deemed consent in Nova Scotia, I'm basically just going to be summarizing two studies here from this LEADER program. Matthew Weiss is the first author on both of these papers, but the contributions are from basically the broad LEADER team. So deemed consent in Nova Scotia, we know that Canadian organ donation rates are quite low compared to other countries, and we'd like them to go up. And in Nova Scotia, the rates are not increasing like they've seen in some other provinces. They've kind of stagnated a bit. So on April 12th, 2019, the Nova Scotia legislation passed modifications to the Human Organ and Tissue Donation Act, which included deemed consent. And this was made, ratified and made into practice on January 18th of this year, becoming the first jurisdiction in North America to do so, which is quite impressive. And this new legislation should not be seen maybe as an isolated act, but it's kind of part of an overall initiative to increase the system support and the financing to increase donation and make transplantation more effective all across the province. So people need to register their decisions to not be a donor or to be a donor of only some organs and tissues. And families will continue to be consulted about their loved ones' wishes regarding organ and tissue donation. So there is this kind of family veto aspect to the legislation in Nova Scotia. And if you're interested in learning more about this, there's quite a bit of work out there, but this is something from our team here at the University of Alberta, which is evaluating the family veto of consent for organ donation. So some of the issues there about an individual's choice and the family's choice and kind of how they can work together or cause some issues. So what is Nova Scotia's LEADER program, which I'm a part of? It's a Health Canada funded program of research that will evaluate the implementation process and the impact of this deceased organ donation legislation and the health system transformation in Nova Scotia that includes opt-out consent. So there's a real need to evaluate the impact, not only to see how this is going to work in Nova Scotia and Atlantic Canada, but other provincial, national, and international jurisdictions that might be considering the same kinds of changes. Is it effective deemed consent around the world? Well, there's lots of countries that have deemed consent models, including ones with really high performing donation systems. Some that come to mind are Spain, and a new iteration might be Croatia and also Wales. But the impact and the effectiveness of deemed consent remains kind of poorly defined and a little bit controversial. And there's a lot of discussion on this topic, and there has been a lot of discussion on this topic about how it can work to improve the system. This was an article, for example, from 2017 in the Globe and Mail by Andre Picard that says it takes more than just the laws to boost the organ donations. Some countries have had some problems with the model. An example is Brazil in the 90s. And some countries might show that deemed consent doesn't really have a huge impact, not necessarily a negative impact, but kind of a neutral impact. And the general consensus is that the consent models need to be a part of a wide system transformation in order to have effectiveness. So it's kind of one tool that can be used. The specific aspects of the LEADER program include a collective of clinicians, administrators, researchers, and other stakeholders that will be conducting these kind of evaluative summaries. And so as well, in addition to examining the numbers of donation and transplants, as Laurie mentioned in the introduction, we're also looking to analyze the views and the attitudes around donation and transplantation. So this is the quote here: the overarching goal is to apply rigorous scientific methods to generate knowledge that provincial, national, and international stakeholders can use to inform and implement legislative changes in other jurisdictions. This program will ensure that we understand the impact of implementation, including increased clinician awareness of the need to identify and refer potential donors, the number of people who agree to become donors, the economic impact, the number of transplants, and the attitudes, as we mentioned. So there's some limitations that come with the applications of this study. Nova Scotia, as we know, is a smaller province in Canada. It only has around a population of around a little more than 900,000. There's a specific culture that exists in Nova Scotia, as you know, different cultures exist in our provinces, and it's a little bit less diverse. So population around 6% visible minority versus around 22% in Canada. And there's three main activities that make up the LEADER program. The first one is evaluating the performance of potential donor audits, which basically just kind of measures how often eligible people end up becoming donors, how well the system works. Activity 2 is understanding the experiences of deemed consent internationally. So again, looking at other contexts and seeing what has worked and what hasn't. And number 3 is understanding the kind of public perceptions, healthcare professional knowledge and attitudes. So this includes mapping out the concerns from the general population and different subgroups who might have different issues around the topic. So this includes having focus groups, for example, with nurses and members of the general public, conducting surveys and analyzing online discussions. And that is where my role came in as a health kind of online media researcher. We conducted 2 studies as part of this leader program. And the first one is kind of complete. It's waiting peer review. And the second one is we're at the very last stages of it. So the first one is looking at the initial public response, basically after the announcement. So what was the first impression that the public kind of had of this when it was announced? And then later on, we wanted to see maybe if that perception has unfolded or what we can learn as time has gone on and maybe more people have had discussions either online or off about the changes. So our first study, the legislation makes news and the public reacts. This is the name of our study here. It's currently under peer review at PLOS 1. So the title of the paper is Online User Comments Responding to Deemed Consent Organ Donation Legislation in Nova Scotia, a Divided Public or a Few Loud Voices. So what basically happened is in the early April of 2019, 2 CBC articles were published and they generated a lot of response. This was the first one, and it had around 1,900 comments and replies, which is quite a few for something that's specific to one province. It's not a full-on national story. The second was published 2 days later, which kind of talked about some of the ethical concerns that might exist out there. It's, as you can see in the title, it sparked some mixed reaction and it got over 700 comments and replies. So we were looking at a data set around 2,600 comments and replies, which is quite substantial for just 2 articles. So we were asking, how are people commenting? What are those in favor saying? What are those in opposition saying? How are participants in the discussion reacting to the comments? So what's going on in the reply chains and what kinds of comments are generating more replies? What kinds of comments are getting likes or dislikes? Are any trends evident among the participants? For example, what can we learn about the total numbers that we see there? So we basically performed content analysis, which is kind of coding the comments for what the comments are doing and organizing them into types. And then we perform some statistical significance, some ANOVA tests to see if there was significance to the numbers that we were looking at and the trends that we were observing. So we have a big, data set here. You can see it's mapping out all the kinds of different participants and the numbers of comments, negative comments, positive comments that we coded, the replies to those comments, the likes and the dislikes, etc. And we were looking at basically a total of 512 unique people. So a fair number of people were contributing to these discussions, unique individuals. Of course, we can't generalize these findings to the public. We can't take this and say, this is how the public feels about this, because it's not a representative sample of the public, but it's a relatively large number of a data set of people contributing. So the key results that we found is there were more negative than positive comments. So there was quite a bit of negativity in there. The negative comments were generating more replies, more discussion. That might seem obvious, but it's good to know that when someone had a problem with it, it created greater change. Basically, arguments were going on. The negative comments were responded to with more negativity and the positive comments with more positivity. So this suggests that the general population who was participating in the conversations didn't like when people were being negative and liked it more when people had positive things to say about the changes. And importantly, the negative comments were made by significantly fewer participants. This basically means that there were a small cluster of participants that were very, very active. They would make a lot of comments, they would make a lot of replies, and they would contribute heavily to the discussions. So the kinds of concerns that people had, just as a brief overview, right at the top, the main issue is this idea of government usurping its powers, kind of the government stretching too much of its hand over the public. And inside of that, there's also discussions around ownership, like the government taking ownership of the body. So these kinds of overarching principled issues. In the middle, you had some discussions around people saying, I'm for donation, but I'm not in favor of this, or people talked about potential profits and people profiting from it. They worried about consent or that the current model was good and should be improved. And down at the bottom, you had some issues around whether or not there was enough consultation with the public, or if the infrastructure was sufficient, or that there were some moral issues there. But the biggest issues at the top were on principle and government power, kind of the overwhelming majority of the concerns expressed. The people who were talking positively about it or say that the laws don't restrict autonomy, a clear and obvious choice is available, it facilitates altruism, basically it saves more lives. The previous policies were not effective, so we needed something new. Other countries have been successful. The organs can go to waste if we don't use them. Some argumentation, but not too much, about those who opt out should not be able to receive an organ. So kind of more combative comments. A pride in Nova Scotia was expressed, as well as a little bit, but not too much frustration and anger and annoyance at the opposing positions. Some of the neutral comments just included general reflections on the conversations. There were some attempts at humor or general political conversations, as well as some questions, not too many, but people kind of asking, oh, how is this going to unfold and what does this look like? So seeking information inside of the conversations. So the key takeaways from this first study is there were strong opinions and there were some heated discussions. It could be a bit of a polarizing topic, at least online. The negativity, as I mentioned, was spread by small numbers. So some people seem very dedicated to spreading these thoughts, which is important because it might create a false impression of the public sentiment around the changes. We know that the numbers aren't generalizable, but sometimes if you see a lot of this online, you'd say, oh, a lot of people are opposed to this, but perhaps that's an inflated sense, and the numbers that are coming out of Nova Scotia the numbers that are opting out do sense that this kind of discussion was inflated. It doesn't match up with the numbers that they're seeing in the public sentiment in terms of responding to the changes. But important is the propagation of this, because this isn't just how people feel. They are putting forward other ideas that might influence other people. So it might impact other people's public actions or how other people perceive these things. This could include, for example, the spreading of misinformation, which we're seeing a lot of in COVID with some of the vaccine discourse online, creating hesitancy or people basically not willing to get vaccinated for different reasons, lots of them which are based on misinformation. The negativity, as I mentioned, was more based on principles. So this kinds of ideas of freedom or anti-government or autonomy, and there were some conspiracy tinged sentiments mixed in there. And as we quote here, the issue of trust permeated through the critical commentary. Individuals expressed suspicion around government activities broadly, but also expressed mistrust towards healthcare systems and medical practitioners. So what we concluded here was that it'd be very beneficial for governing bodies to talk about why the changes were needed, how the policy will be enacted, so very clear documents that can be produced, what exactly is the power of the families to veto, and what can be gained from the policy. It would also likely be helpful to have a range of stakeholders disseminate knowledge, so medical experts, maybe even religious leaders, various political leaders, perhaps even political leaders from both sides of the political spectrum or all sides of the political spectrum, as well as influential members of the community from racialized or marginalized communities to have some discussions as well, or to spread some of the initiatives about what's going on. And lastly, explanations of the organ donation and the transplantation process, as well as the legal foundation of the legislation, might prove useful for building consensus in some contexts. So that was kind of the first study. And so the second study, which took place much later than this, this was in the early part of 2019, was looking at Facebook groups, specifically Facebook groups based in Nova Scotia, and how they were kind of talking about deemed consent. So the timeline here is from June 30th, 2020 into the very early parts of 2021 of this year. And what we did is we searched for public Facebook groups. So again, not private groups. We didn't want to impinge on any privacy, but public groups that anyone can participate in and anyone can read. And you can see the group names all on the left here. The number of chats in the data set and how many total comments. So what you see is you do see some government, which is quite interesting actually, some government pages do get a lot of activity. The first two that you see at the top, Nova Scotia Department of Health and Wellness, lots of comments there, lots of comments in Nova Scotia Government, and Nova Scotia Health only has one. And then you get quite a bit of media. So CBC Nova Scotia, a radio show Q97.7, Chronicle Herald, and some more specialized groups like Halifax Muslims or Black Nova Scotian News, as well as a little bit pockets of discourse as well. So in total, we were kind of looking at all these posts had around 2,300 shares and 4,800 reactions. So what we were doing here is we were performing thematic analysis on all of the different comments that we saw inside of these groups, and then a little bit of content analysis just on the comments that were most reacted to. So what comments were resonating the most with people and kind of trying to figure out why. Thematic analysis, just as a very brief overview, is really a really good qualitative analysis. It's good for capturing the social phenomena. It doesn't provide stats of what's going on more or less, but it kind of captures how people are discussing things in a very rich way. I can't share all of the quotes with you today because the analysis is just at the last stages, but I'll give you a good overview of what's going on. And for the content analysis, we could identify some specific trends with basic descriptive stats about kind of which comments are liked the most. So there were 4 major themes that emerged: supporting donation and changes to legislation, contesting and opposing changes to legislation. Some people that sitting in a more neutral position, so discussing particulars and maybe pointing out some issues, so not necessarily against the new legislation, but having some qualms with it. And the last one, kind of meta commentary, softer reflections, jokes, and questions. It's kind of neutral pocket. And of course, in order to make these themes full, there's corresponding sub-themes to each of these, which I'll talk about now. Of course, you couldn't talk about social media with including some little summarizing emojis there at the top. So the first sub-theme for supporting donation and changes to donor legislation, these people are obviously in support of the changes, and they do so in a happy way. So this first sub-theme is kind of caring about donation is caring about others. This was people talking about how donation and transplantation is something to be respected, promoted, encouraged. It's altruism. The legislation will save lives, and bodies are meant to be shared and they're meant to be used to help others. Lots of expressions of care, simple congratulations or applauses, or it's about time. People wanting to help and expressing the desire to help. Lots of personal anecdotes of donation benefits. So great storytelling of people sharing quite beautiful and touching stories. A real pride expressed in Nova Scotia, being the first province to enact, to be bold and to take a measure like this. They were kind of reacting to others who were opting out with surprise and dismay, like, I don't know why you would consider doing this. And there was kind of an implied trust in healthcare workers here. The sub-theme 2, again, for people that were in favor of the legislation, was much more critical and argumentative. So this sub-theme is the legislation should not be contentious, it will work well, and here's why you idiots are wrong. Again, there was argumentation here, and at times very aggressive argumentation. These are the common kinds of argumentation that were put forward. So choice and autonomy is maintained. One can easily opt out. Opting out's easy. Anyone can do it. Bodies should be used and they won't get used otherwise. And there's this kind of aggressive idea that the body's just going to rot in the ground if you don't use it. So you should absolutely use it. There's some name calling, questioning sanity, questioning intelligence, and this argument of opt-out consequences. So again, as we saw earlier, if one opts out, you shouldn't be able to receive. It's kind of a common argument that was made. A bit less common, but also in there, kind of describing how this aligns with how the state deals with the deceased with regards to wills and estates and things like that. That Canada is not the first country to enact the legislation. There's other ones that have done it and done it well. Detailing a few examples with key statistics that you're much more likely to need an organ to donate. This wasn't present in many discussions, but it seemed to be quite impactful when it was there. And of course, the system can be trusted. And interestingly enough, in here, there was people correcting misinformation. So trying to debunk some of the myths out there, which was interesting to see. So those opposed to the donation, our sub-theme first one was opposition on principles, again, as I mentioned earlier. So this is basically just against the legislation on world or social beliefs. This is the government coming and taking away rights and freedom, rights of autonomy. They talked about the slippery slope. It's my body, it's my choice. You know, what rights are we going to lose next? It could be against religious or spiritual beliefs, so it's immoral or unethical or wrong. Principles of consent. So there's an absolute expression of consent, and that's something that can't be negotiated. A little bit more common was people being supportive of the donation, but not the new legislation, and very less common this against altruism, which was just a couple odd comments that were mixed in. This idea of manipulating the body in undesirable ways, so kind of this idea of chopping was present inside of the discourse, or treating the body in an undignified manner was also expressed here. The sub-theme 2, they're out to get us, they're not to be trusted. So this again was in opposition to the new legislation, but it was very kind of tinged with conspiracies and this idea that the government's out to get something from you. So the lack of consultation and transparency for the government being sneaky or tricky. This is the first time hearing about this, why. The government kind of duping the public to take advantage of them. General mistrust in party leader. This was passed under the Liberals and McNeil, so that he was called a dictator. There was some slanderous discourse around other countries, the system manipulating the body. So this kind of harvest rhetoric was taken. And interestingly, there was a lot of sentiments about the healthcare system and the government's going to be profiting from the organs. So it's all about money. We're going to be the organ factory of the world. It's going to cater to the rich, and the poor will get worse service. Some taking advantage of vulnerable populations, for example, those with mental health or dementia, the homeless, etc. That the healthcare system won't know what it's doing, and it will transplant infected or damaged organs without knowing it. And they should make more efforts they'll make more efforts to donate organs than to save people's lives. So they basically won't try to save people and revive them so that they can get at organs quicker. And that the system kind of will produce errors. So they're not competent enough basically to store the information and keep records. Last, sub-theme 3, those are opposition. If it ain't broke, don't fix it. Changes aren't needed or justified. This is quite straightforward. Arguments questioning why it's needed. So if people wanted to donate, they would. Why do we need new legislation? It was better before. It's illegal. It won't hold up in the courts. There's costs associated with changing legislation, and there were suggestions put forward for change. When you renew your health card, there should be stricter procedures to get a new health card, etc. Those kind of in the middle, discussing the particular issues, but not necessarily against it, included gay donations respected now. So this was some of the issues around organs from gay people's donations will be regulated like blood donation, and people seemed offended at having to kind of raise this issue. There was a sub-theme around religious beliefs in favor, against, and exempt. Quite interesting discussions were had. They were questioning how donation aligns with religious beliefs. There's less concern specifically with the legislation and just more how donation and transplantation aligns with religious tenets, and it was supported and written against in both contexts. Often there were assumptions made that the people who will be opting out for religious or spiritual reasons, it would be fine. People said if people want to opt out for those reasons, that's completely fine, and they should be able to do so without any judgment. And as I mentioned, there were some explicit cases raised where religion seemed in conflict with donation and transplantation, but then also numerous arguments that said religion support, and being a good member of your religious community is supporting donation. And lastly, some people had issue with family veto, this idea that perhaps the family could override one's individual choices. And this again came, as was mentioned earlier with Cindy, the importance of having discussions and discussing with one's family what one's wishes are. Very important to have ahead of time. And this is also on Nova Scotia's webpage discourse, which talks about the changes in legislation. And lastly, number 4, meta commentary, soft reflections, jokes, the jokes, the classic one, no one's going to want my liver. Questions, asking for clarification, links to opt out. Very encouraging to see people are saying, oh, what's the case with this? Can you send me the link to this? Does anyone have a link to the website? And the moderators of those government web pages that I mentioned, it's very interesting because they participated actively in the discussions, and they would correct some misinformation, but also just continually refer people to the links, which seemed to be a good way of curbing some of the confusion or the misinformation that was being spread. Some people reflected on the discussions without a clear indication of support, so they would just laugh or say haha or something like that. And as I mentioned, the clarification of facts. Lastly, the content analysis is kind of a little bit confusing to explain, but we'll just give it a quick overview here. What we did is we looked at the top 3 most reacted to comments in each discussion. And so what you see here on the left is all the comments, this is the reactions, and green means positive. So basically what was reacted to the most was with thumbs up. So that's overwhelmingly the most common. But the kinds of comments that people would give a thumbs up to included a mix of positive and critical. So these red ones here you can see where critical opinions were expressed did get quite a few likes. So there are pockets of people that do have a problem with the legislation, at least online in some of these communities. But we also saw a lot of the pro legislation comments get thumbs up, and some of the specific aspects of pro, which was very interesting to see, were debunking critiques. So where people would correct misinformation, or they would correct someone or kind of call out someone who they thought was not contributing positively to discussions, got a lot of likes. Those are all the yellow ones. And the pink ones you can see are personal narratives. So we know that personal narratives can have a great impact on how people perceive topics. And this is evident here as well. People sharing positive stories of the donation process and that receiving a lot of likes, sometimes the most likes in an entire chat room or post. So our key conclusions here, there's lots going on, lots of rhetorical functions at play. People are expressing ideas, convincing others. They're trying to kind of maybe build followers online, build networks. They want to have their ideas reflected back at them. And so basically, these discussions matter to the people that are in them. Facebook's a place, is sometimes people think it's a very awful place to be, but it is a space that we do want people engaged with who can correct the information or guide people to good information. And different tones are created inside of these discussions. So some conversations would get negative and kind of stay negative, and some would switch over and become a bit more positive. And that sometimes happened when the moderators of the sites were involved, or where people would share touching donation stories that could change the tone. So it matters basically how people talk about these things in these spaces. There's very different relationships to the government and the collective and the individual. And that basically means that we need different approaches for public outreach. We can't assume everyone thinks about the government or the healthcare system in the same way. And we need to think about different ways that people understand those systems and what works with them, what would resonate with them. There's a divisive theme amongst the participants between a fear of death and managing death and what a dead body is. And again, it can be a sensitive subject for many people, and that's important to keep in mind too when we talk about public outreach. The power of the legislation to generate conversations and discussions. So this is kind of what they call the soft effect of the law. So it's one thing to ask people how they feel about donation, but when something becomes law and it becomes legislation, it becomes a hot topic. It really gets people talking about something and how they feel about certain things and having conversations with their families. And there's a real benefit to being the leader. You know, Nova Scotia is kind of leading the way in Canada about how these things can unfold and what we can learn from them. And this was similar to Portugal and Uruguay, who legalized marijuana and other drugs before other countries. They kind of act as a leader that other countries could follow if they wanted to, or they could learn things from these countries. Importantly, the people that were pro the legislation seemed very combative and sometimes very harshly combative. And that likely stems from the frustration they feel at other people who are not reading the law or misinterpreting it or trying to spread misinformation. And some of the combativeness maybe is necessary, but it's important to be compassionate too. If you just constantly antagonize those people in opposition, it's likely going to just increase tension and create more negativity. And research has shown even more extreme views. So we have to be careful about how we kind of talk to people that might be in opposition or even people that are spreading misinformation. So our overall conclusions from the work: online spaces are important, and we need experts and researchers to be engaged online with some of these conversations, to correct misinformation, make changes, sharing good quality information. We need to listen to other people's perspectives, understand those perspectives. We can't use a one-size-fits-all approach to public outreach. We need to promote different angles and things that will work well in different circumstances, but all of the outreach needs to work towards trust and transparency in our healthcare systems. And the public outreach needs to come from lots of groups, lots of medical experts, community leaders, different organizational groups, etc. As they wrote here from Matt Weiss from the Leader Group, organ donation relies on public trust, which must be earned from grieving families at the bedside of a dying or recently deceased loved one. These families must be confident that all appropriate measures to save the life of their loved one were pursued, and that organs will be allocated in a just and equitable manner. If the medical system does not have that foundational trust, deemed consent could be seen as an overreach by a system more interested in transplanting organs than treating severely injured patients. And so, as I've said here, online spaces can and should be utilized as spaces where trust can grow and where correct, accurate information can be shared. And that's what we can think about as we go forward. So thank you so much to the Alberta Transplant Institute for having me, for the Leader program, for my institute, our small team there at the Health Law Institute, University of Alberta, and of course, Health Canada, Canadian Blood Services. Thanks a lot.
Thank you very much, Sandro. That was really very, very interesting. I'd like to encourage people to put their questions in the chat or indicate that you'd like to ask a question. And thank you to both of our speakers today. Can I just start by going back, well, pointing out that, of course, Nova Scotia isn't the lead only in Canada on this, but across all of North America. So I think that's a fairly powerful position to be in, and clearly it seems was recognized as a positive thing in your feedback here. One of the things that you brought up early on was the context of general system that opt-out in the places where it's been enacted has been in the context of overall effective systems for organ donation. Can you comment on that a little bit as well?
I wish I had more to say or more expertise specifically on those contexts. Unfortunately, I don't, but I do know more peripherally that they've it wasn't that a country like Spain, for example, which has one of the highest donation rates in the world, simply said deemed consent, and deemed consent was the solution to, or the reason that the rates went up. I think there was a concentrated effort to connect all the regions of Spain into one network, to have really good communication, clear communication, open access of transplantation, sharing of donation across perhaps jurisdictions that didn't do so in the past. Increased funding, I think, went into that, increased public outreach efforts. So some of the things I mentioned, some of the soft approaches that I mentioned, having people become aware of this. So instigating conversations amongst families, inside community groups. How do you feel about donation? What are your plans going forward? And having that be a part of the culture is what I've heard exists in a place like Spain.
Mhm.
And Croatia, I've heard, is also, so they have the aspect of deemed consent as part of the system, but it's kind of a larger, one tool of a larger overhaul, let's say, or systemization, a structurization of the system to make it work really well, if that makes sense.
Yeah, yeah, no, I think that's really important. That's been pointed out before. We have a question in the chat from Linda Powell. Initially, I understand that the donor per million rate increased in Nova Scotia, possibly due to increased awareness through conversation and public messaging, demonstrating possibly the impact of good lead up messaging and public outreach. Do you have some thoughts on that? I think to Sandra.
Yeah, I know from talking to the team members that they've seen really positive responses, not just to this, but even before the whole year. It's tough to pinpoint exactly why those things happen. I think there's seen some reverberations or some echoes from the Humboldt Broncos tragedy, which happened because his family, Logan Boulet's family, was really quite active in promoting organ donation. So that perhaps resonated there. I'm speculating a little bit, but there's perhaps more conversations being had in that context. So they are seeing numbers rise, but then from what I know so far, there's been very, very few people opting out in Nova Scotia of this particular legislation, like very few. I think around 1%. I don't have updated numbers, so don't quote me on them, but yeah, it's received positively in perhaps what matters most, which is the actions that people end up taking in the end.
Mm-hmm. Yeah. And maybe Cindy could comment on that as well, as given an opportunity to share your story and the impact of what you went through as a family, striving to enact the wishes of your daughter. Do you want to comment on that in the public discourse?
Yeah, I think it's important to just share what you know, share your experience. Talk about many different things. Even an open casket, when we talk to our friends, I like to mention that we could have had an open casket funeral, because I've had people say to me, I don't want to be cremated because I want an open casket funeral. We could have had an open casket funeral for Morgan. Lots of people think the body's not going to look the same, but they do lots of good work. So just having different conversations with people about everything, I think, is most important.
Thank you for that. We've got two hands up. One, Kieran. Kieran, would you like to ask a question? And then we've got some more in the box.
Yeah, first of all, thanks to you both for a great talk. Alessandro, I had a question for you just about the methodology. I haven't seen this before in terms of, sampling online commentary, and I want to, congratulate you for wading into it. It seems like it would quickly destroy my faith in humanity, spending any amount of time there. But I do want to ask about that specifically. We often perceive there's a real negative skew, especially in comment sections. And so do you know how this kind of data calibrates with, more systematically collected data if you were to survey the population via different methodology? And I know that there's ways when you do those types of survey methods of correcting for those kind of sampling differences. Is there ways of doing that with online comment data?
Yeah, that's really interesting. I think that as part of the leader program, I'm housed in activity 3, which does include those kinds of things. So you're supposed to bring together all those different analyses into an overarching understanding of public perception. So you'd combine the focus groups with the surveys with some of this discourse. So as you mentioned, there's a lot of challenge of producing anything that's generalizable, but you can also get at the way that people contribute online, as I mentioned, might not necessarily align with how they respond in a survey based on how the survey is designed. So they might respond, in a particular way on a survey, but then be very active online for a different reason. And I just found what Cindy said very interesting there, because that's a case perhaps of not necessarily like malicious misinformation that we think, but some people can not understand that situation and they can propagate that. So they might have that view that doesn't get touched on, but then they go online and they say, this is why I'm opposed to this. I would never have this happen because of an open casket funeral, let's say. So it's important there to see how people respond to that, right? Is that liked a lot by people? Do people say, yes, I agree, that's why I'm not doing it? To some people, do you see that being contested? So it's more about kind of how that information is moving than it is about necessarily how the public feels about it. I don't know if that completely makes sense, but
I think so. So you're sort of saying it's a qualitative, much more qualitative analysis than kind of a quantitative representation of the population's views.
Yes, and the quantitative piece that we took away, which is important from the first one, because that was done much earlier, is that the negativity is overwhelmingly produced by a small pocket of people. So we did have an indicator from the beginning that this doesn't seem like it's split amongst the population. It basically has a small group that's very adamantly opposed. And that was a quantitative finding that we could take, and which we did see resonate with some of the other work that was going on in activity 3.
That's great, thank you.
Yeah,
That's very helpful. Yeah. Phil Halloran.
I just want to congratulate this magnificent family for its gift and its leadership, but also to congratulate Nova Scotia on doing this. We've had many collaborations with the Spanish transplant leaders over the years. And what they've told me is that the legislation was not the important thing in terms of its utility. The legislation was important in getting the discussion, and the discussion is how Spain changed. And the idea that you bring forward this legislation, not so much to use it, because you'd never go against vehement opposition by a member of the family, but what you would do is the discussion that's triggered by your legislation can change things for a very long time and actually build trust. So I think I very much congratulate you on what you're doing, and think that the use of the opt-out legislation may turn out to be less important than the discussion that you triggered. I wonder what your thoughts are.
Yeah, I'm fascinated by that idea that a discussion changes when something is going to be actualized, and we saw that a lot when we discussed the legalization of marijuana in Canada. And we saw it just heightened. It became a second level of discussions that can be had. And then you can start producing real evidence, are there unsafe ages that people should use marijuana and why, and what are the studies that are being produced? But the discussions change from hypothetical to real. And it really is, I think, people that maybe are more on the ground than myself in Nova Scotia can reflect on. But fascinating point that's what was observed in Spain as well. Very interesting.
Yeah, I think that's a really important point. And I wonder, Cindy, whether you have some comments on that. We've had a question again from Linda Powell, specifically asking what parts of the process itself supported you as you made this decision. And was it partly, perhaps, do you think, because of as Phil Halloran just said, the increase in the conversation itself, the fact that the conversation brought about by this impending legislation made things perhaps more open and easier to discuss? What do you think?
Absolutely. I love to tell my story to whoever I can. And they share it with others too, right? When somebody's telling them personally what their personal experience was, it really sets home for a lot of people. And it's a great way to share. Another thing I want to share too, I don't know why, but this is coming to me right now, is we donated Morgan's pancreas as well. And we donated it so that it could go to medical students learning about type 1 diabetes. I've had a few people say to me, well, I don't want to donate my organs to medical science. And I honestly felt that way before, but knowing that this is going to help them figure out this disease, it's something that's beautiful too, I think.
So perhaps the opportunity to have open discussion of all these aspects of the process.
Yes.
To bring it out for discussion, to make it a topic on the radar all the time, rather than just once in a while, maybe was helpful.
For sure, for sure. And just talking about it and letting families know it's okay to have open discussions about it. That's the biggest part, I think, is making sure you tell your close ones that you do want to be an organ donor. Opt out will be wonderful for that reason, because automatically they will be unless they've opted out. But I've met so many people that have said to me that, oh, I want to be an organ donor, but I haven't signed up yet. And they haven't taken the time. And then once they heard our story, they send me a text or over Facebook or whatever and say, we signed up today. Thanks, Cindy. Like we knew that we wanted to be, even our children signed up. So yeah, just putting it out there to have those conversations.
Great. Thank you so much, Cindy. We have a question from our MLA who's in attendance, RJ Sigurdsson. Please go ahead.
Yes, thank you so much. And Cindy, it's so good to see you again. And I know that you and I were brought together in a very unique way when I got drawn for my private member bill and found out I was going to be able to table a bill, and reached out to you just before your CBC article went out. I think the stars kind of aligned there. So I think Morgan was speaking to both of us in very unique ways. So thanks again for your story and sharing. I do want to drive, as I am moving with a private member bill within Alberta here that I will be tabling and are sponsoring on organ and tissue donation. I'm in the front end process. I do have a draft bill together, but I'm still driving down to details, and I found your presentation very interesting. I do have one question that I kind of want to ask you is, when you talked about the debunking and what we need to do, I mean, there's a huge thing about changing the culture and educating people that I think is so critically important about this. And through your social media research, when it came to debunking, what were your thoughts? What were the best ways to educate people? Resources? Was it links? What do you think was most effective in that piece of taking and getting rid of some of that misinformation and educating people through that process? Was there any kind of linear findings that you had in your research?
Well, there's been a lot of research that's going on about this now, about the best ways to do it, and it's still quite preliminary in terms of knowing completely what works. But you don't want to have indisputably incorrect facts sit there. So you want them to be contested, and it's better if they're contested by lots of people in non-antagonistic ways. So a very common one that came up in the second study was, this is the last day to opt out. And if you don't opt out on this day, you don't have the chance to do that going forward. And what you saw in there from the moderators of the page, from individual people, is that's not true. Here's the link. That's not true. You can opt out anytime. And it wasn't just one person, and it wasn't just the moderators, but by the moderators, I mean the hosts of the Facebook page. So you had Nova Scotia Health and Wellness in that case. And then they would share the link exactly to the site. So your goal in that case, I don't think, is to stop that person from thinking that way, because their motives might be to just have the bill be contested on whatever grounds. But you don't want the other readers to feel that way about it. You want them to immediately see that other people are contesting that information. Keeping antagonisms down, it doesn't hurt to raise, it doesn't help, to raise the antagonism. So calling people, name calling them idiots, it's not going to help. It might feel good in that brief second for some people, but it's not going to help the correcting. The tougher part is where you don't have indisputable incorrect facts being shared. So when there's softer things, that becomes a harder, how do you change perceptions and things like that. But narratives are helpful. Narratives combined with accurate, clear information that's easy to read, that anyone can read at any kind of literacy level, perhaps having other languages and different members of the community share it. I think in this context, it would have been helpful if this was passed by some liberals in Nova Scotia. If there were some conservative politicians who were in favor of this, it would have been nice to see some discourse from them produced about this, saying that they were in favor as well. So you can break down some of the political divisions as well.
Great, thank you. Thank you for your question and for the answer. We do have, we can go a little bit over to get to a few more questions that have come in. So anyone who would like to stay, please do. We have from Ann Halpin, thank you both, what great presentations. Thank you especially to Cindy. It seems to me that we need more scientists on social media for sure. But I also think that science communications are not really taught to scientists. Tim Caulfield tweeted today about a study showing that scientists who have engaged with the public have had negative experiences, including death threats, up to 15%. Do you have any suggestions on ways to better incorporate the scientific voice into important conversations in social media? And what about platforms used by younger people like TikTok? Perhaps you both have comments on that.
Cindy, is there something you want to share on that first?
Oh, I don't know. I do think it's great to put it out there and put it on social media because let's face it, that's what most people are looking at, and that's part of our world now. It is great to share our stories and just share our experiences.
And thank you, Cindy. And Sandra, do you have some thoughts? There's a lot, of course, going on about science communications and misinformation and so on in the context of COVID. But what about some of these thoughts?
Well, I think that like most things that are approached with science, people need to read the science and spend some time reading the science about what works and what doesn't. So if you are a scientist and you want to be a communicator, you have to spend a little bit of time doing some research in terms of what is effective and what's not effective and how you can go about doing that. And be willing to that if you're going to be in the public, you're exposing yourself to some of those views. So as I'm sure Tim would say, keeping that in mind, knowing the kinds of discourse that you're going to be met with and maybe having mechanisms to cope with that, or ways that discussions you want to participate in, but other ones you don't want to participate in. I mean, your mental health is important as well, right? As you're trying to tackle some of these topics online. So you have to be careful about that. But I think lots of people find their own way. They say, oh, this is something I feel like I can do and I can contribute positively in this way, and these other conversations are not for me. But in terms of the platforms, yeah, younger people and different kinds of platforms, TikTok, a lot of people, it's a small number in the overall population, but a lot of people go on Reddit to get information about very technical things. And it's kind of an overlooked site in some cases. We've done some work on Reddit and seen really productive knowledge sharing going on sites like that too. So.
Great. Did you have a follow-up, Anne?
No, thanks. So interesting. I use social media all the time, and I have like a notes on my phone of links to put in for like debunking things, just because I feel like I need to keep posting the same links over and over. So if you were collecting data in Alberta, I would probably have a comment in there somewhere that you would have collected. But it really strikes me how we don't learn how to really communicate science in lay language. We're not generally good at it, I think. And I think that's something that works against science in general, that we would all benefit from learning to actually speak science in a more digestible way. And I think that's a real problem. And I don't see how that's being addressed anywhere. And I don't know what the answer is, but I think it is a real deficiency, and I think it works against us.
I've seen, as much as there's, you've seen lots of the horror stories from COVID, there's been lots of really positive accounts that have gained some traction too, explaining statistics around, trials and things like that have been remarkable, how clear they were. I was like, oh, some of that stuff goes over my head. And I was like, oh, that's incredibly clear. An interesting one from COVID was that people said, I don't want to be the first, which basically tells you they have no idea about the phases of the trials, right? So it would have been nice to see people giving some really clear TikTok kind of views or whatever, and really short videos. What is a phase? What are the 3 phases of the trial? How does it actually work, right? And what does it mean to build that statistics? Because one of the common myths around COVID is that it was rushed, right? The science was rushed and people tried to combat it. I think did a good job. Lots of people did a good job and they learned from it. So it's
Well,
just
maybe that, one of the nice things to come out of the LEADER program in terms of the context of that in organ donation will, I think, offer us ways forward as we look at evolving practices in other provinces, including here in Alberta. Yeah.
Yes, that definitely seems like a goal in the group, right? What can you take from Nova Scotia, and you can start to forecast, because you reach a kind of a, although you don't have the numbers for the generalization for the population, you reach a saturation. You can already see from our 2 studies about what's said. So you can forecast for other provinces, these kinds of things are going to happen. You can start thinking about the messaging beforehand, which could be really, really effective.
Yeah, I think that's really helpful.
Yeah.
Just a few more questions. Murray Wilson asks, it seems that the so-called silent majority voted through increased donation. Does Alessandro's work take a look at the differences between the outspoken on social media and those that quietly act through these actions?
Yeah, that's a tough one to see. The question is kind of seeing how the discourse aligns with the actions. Am I understanding that right?
I think so. Murray, do you want to comment?
Exactly. As Linda raised earlier, the deceased donors per million statistic in Nova Scotia started to raise dramatically after the announcement rather than after the enactment. And so there was a silent majority actually taking action that weren't necessarily the same people, a smaller number of people that were communicating aggressively perhaps on social media. And I'm just wondering how you differentiate in your analytics around that silent majority versus the vocal few that are on social media.
Yeah, it's a great question. I think if marketers knew the answer to that, they'd be, omnipotent. They could get you to do anything at any time. But I think what you're saying is so important, right? You need to match up what the sentiment expressed is with how that translates into actions. And the good example is that they've seen very few people opt out. So if you were to take the social media numbers and to kind of that illustrative divisiveness online, you would see that that doesn't actually play out in the actions. So what it helps you to do is to understand those who are opposed, what kinds of arguments they're using and how they're spreading that, and then try to curb it. And hopefully your numbers stay, if that's your goal, right? To have legislation be enacted and work and etc. Yeah, so you can use that as a tool, right? So it might not be an indication necessarily of the public, but it can be a tool to make sure the programs are working in accurate, clear ways.
Mm-hmm. Just a few more questions from Jen Clemes. Sincere thanks to Cindy and Alessandro for excellent presentations. Did Nova Scotia need to increase the number of hospital sites where medical teams could accommodate those people who wanted to be donors as the number of donors increased? I agree that sharing personal stories and starting the conversations is critical in making inroads for increasing organ donation across the country. This is topic is imperative. So the question is an impact on the healthcare system. Thank you, Jan.
I don't know. The answer to that is I don't know the infrastructure development. I really don't. So someone more who knows more about that than me would know that. But I do know, as I mentioned at the beginning, that it's a tool as part of building the entire network and strengthening the network. So I imagine that there is increased financing to infrastructure as well.
Right. That's maybe that will come out of different arms of the LEADER evaluation program, I imagine.
I imagine too.
We have another question from Nordine Barka. What is the impact of last 2 years of COVID vaccine debate and pushback on this organ donation, especially here in Alberta?
Yeah, I think that's a really interesting one too, because people are asking to what degree is there overlap in these kinds of discourses? And is there some of the mistrust and some of the misinformation that's circulating around COVID? Does that apply to other contexts or not? And I think people are kind of waiting to suss all that out. I mean, we're understanding how misinformation moves better and the demographics that it moves in better, and we'll see whether or not that replicates in other contexts or not. It's a really interesting question.
Yeah, it'll be interesting to see how that plays out. We have one more question and then a comment. from Young Lam in Calgary. Thank you both for the wonderful discussion and talk. Our research group in Calgary has also been working on this area to gauge a national perspective and also a unique provincial Albertan perspective.
Nice.
Our first study also looked at online news media articles with over 4,000 comments analyzed qualitatively, and it's currently under peer review with Danielle Fox as the first author. It's wonderful to see how our results align with what you found in your work.
Yeah, very cool. Who was that? Sorry, who shared that?
Young Lam, do you want to say anything, Young?
Hi, yeah.
Hi.
I know we started this program of research back in 2019 as part of a CDTRP grant application. And so, yeah, it was kind of nice. It's more, our results kind of more align with your qualitative analysis that you did with your Facebook online comments. So it was kind of nice to see consistency in the results. Would
you mind, I have my email there on my last slide, but if you want to send me an email or link me to the study at any point, that'd be great. I'd love that. I'd love to check it out.
Yeah, that'd be great.
We can connect you, no problem. So this has been a really fascinating discussion, and I want to again thank not only our two wonderful speakers, but everyone who's participated in this discussion. I'd also like to point out that you may all be interested in the International Forum being held tomorrow and Friday, the International Donation and Transplantation Legislative and Policy Forum. Patricia has put the link there in the chat. This is open to everyone. You just need to register, but that's 2 days of, and there's a wonderful involvement from around the world. And it's been organized by Louis Beaulieu, Matt Weiss, and Melanie Day from CDTRP. And so please register and have a look at that. I'd also like to point out that next week's seminar on October 20th is Paul Keon and Ruth Sapir-Pichadze on precision medicine and antibody-mediated rejection. You can see the link there as well. So once again, thank you to Paladin for support of our seminar series. Thank you to all of you who came and participated, and we look forward to continuing this discussion.